Hey there. How healthy do you want your brain to be? That's the question. And I hope to give you a little bit of a method to figure out how to get the brain that you desire. So, my name is Yoshi Ram. I'm the founding physician at Oasis Family Medicine in 2011. And as you can see from this title, this talks about the WAVI brain scan, which is truly a revolutionary tool for brain health. And let me just make a note here that when I say WAVI brain scan, I might use the term WAVI brain map, or I might just say brain map at Oasis. So, love your brain. It has a story to tell. The question is, how do we find out what story that is? I like to present this idea of a cognoscopy or cognition, right? If we have cognitive decline, it means our brain is getting less healthy. And so in healthcare and in medicine, and your primary doctor probably wants to get your blood work done once a year to see how the physiology is inside of your blood, right, as a marker of your health. You can also, most people know that you can do an EKG to check your heart health. Most women know they're supposed to, once they hit a certain age, get annual pap smears or every couple of years to screen for cervical cancer. Again, for women, once you reach a certain age, everybody knows that they're supposed to get their mammograms to screen for breast cancer, right? Same for colonoscopy once you reach 50 or younger, if you have a family history of it, right, to screen for colon cancer. You can check just with the little pulse ox meter, sticking it on your finger. You can look how well your lungs are allowing oxygen to get into your blood at a certain age for men and or women. Maybe checking your bone health with a DEXA bone scan is really good. However, for our brain, do we do anything? Almost never, right? The only time that we scan your brain, that doctors scan your brain, that insurance wants you to scan your brain, that you're told you should scan your brain is if something's wrong, right? If you have a seizure, you're going to go to the ER. Seizure for the first time, you're going to get a brain scan. If you've had a stroke, you get a brain scan, right? If they're worried you have cancer in the brain, you get a brain scan. Some crazy neurological symptoms or condition, you might get a brain MRI, right? And so the idea there is that in standard medicine, we only get suggested to have a brain scan of some sort after there's a real issue. And that's a problem. That's a real problem, in my opinion. I would rather get the objective data on how my brain's health is right now, just like I do blood work from time to time on myself. I want to know how healthy I am, right? And this goes for everyone of almost every age. I would argue probably 10 and up, maybe a little bit older, at least 20 and up. It's a good idea to get a baseline brain scan so that if something does happen, you can compare to your brain's signature, baseline signature, because not everybody's brain is the same. And I have yet to meet a perfect brain, is what I usually say. So, just some questions for you to ponder as I go through this presentation, which, by the way, I should set this up. I'm going to do kind of a part one and then just going through the basics, and then I'll let you know. And then for those of you who want to continue on and actually see some case examples, you are welcome to watch the rest. So hopefully I get through the next kind of part one in maybe 15 minutes, hopefully. And then those of you who want can stick around a little bit longer. So some questions for you to consider. Is ignorance truly bliss? It's interesting because I find that a lot of times people will choose ignorance over getting a brain scan. And it's because they are actually scared of what it might show. Now, I want to say that I have yet to meet a perfect brain, including my own, including those whom I love the most. And so don't be scared is what I would say, because with objective data, comes power. And then we can use that objective data and use that power to actually change the course of your brain's health and your overall life as a result. I would argue that the brain is one of the more important organs in our body, right? And, ignorance, it's like how many people, brain and heart health really go hand in hand. And so, how many people have a heart attack that's deadly, and it's actually the first time they realize that they have cardiovascular disease? How many, this is speaking to the older crowd perhaps, but how many times does someone have a stroke and it's the first time that they realize that their brain health is not good? However, taking it out of just the older crowd, this is really important to consider for anxiety, depression, concussions. Tons of young people have had concussions, suffer from anxiety and depressive feelings. And so, number 2 question here, why would you even want to know how your brain health is? Like, truly, why? Just going to let that sink in. Why do you want good brain health? Do you know what your brain health currently is, truly? Are you feeling good? Do you really know that it's healthy? That it maybe couldn't be better? Or do you know it's bad and you just kind of want to stick your head in the sand? Or you don't know what to do, how to get tested, and then actually what to do after that? Where do you desire your brain health to be in the near or distant future on a scale of 0 to 10? Do you want it to be a 5? Are you cool with average? Do you want it to be 8 or 9? Do you want it to be a 10? I know for myself, I want it to be a 10 out of 10. I also know I'm not quite there, but I know I'm doing pretty well because I've done the brain scan, done the WAVI brain scan. Probably most important is, why do you want that number that you chose? Again, was it a 5 or a 6? Are you okay with it being a 5 or 6? I would say average brain health is not very healthy, if that helps. And if you chose an 8 or 9 or a 10, if you want excellent brain health, why did you not choose it to be a 6? How important is it to you? So that kind of gets to the end. Why would you not get a WAVI brain scan? Where's the true value? What do you consider valuable? What do you consider truly valuable? And real quickly, just before I forget to mention this, Medicare pays for it, at least currently as of the filming of this video, and most PPO insurances pay for it. However, I would also say if you don't have one of those, what's the value? Like, are you going to depend on your insurance to keep you healthy? I would say that's probably not a good health plan, even though it's good to have health insurance, especially for emergency care, right? I don't want anybody to go bankrupt, but if you're depending on your insurance to keep you healthy, that's probably not the best mentality, right? And so again, I just want to ask you, where is the true value in knowing your brain health and having amazing brain health? So what is the WAVI brain scan? Just going to throw this up here on the left here. This is supposed to be a supercomputer, and so this is a cross section of your brain, a healthy brain, and then this is an unhealthy brain, kind of side by side. So we have the supercomputer brain version over here, and we have many people's brains over here. Do you want your brain to look like this supercomputer or this old pile of trash computer? Unfortunately, and I don't say this lightly, I see a lot of brains that are closer to this than this. So the Wavi brain scan that we do in our office, it does actually look like this. It's pretty easy. Takes about 30 minutes, maybe a little bit longer, depending on how the connections line up. You do use this little kind of headset. The technician will use salt water on the connection, on each connection, to get it to come in contact with your scalp better so that it can pick up the electrical signal. So we used to have to use a lot of sticky gel, which got your hair really kind of crazy nasty. Now it's just salt water, so it's not that big of a deal. And then we're measuring a lot of electrical performance measures of varying types. And the data is collected and analyzed and compared and produced to give you a very comprehensive report, which we will go over some examples of. Uh, the initial testing before symptoms helps with the early detection and prevention of neurological and even cardiovascular and mental illnesses. And then really just retesting over time may be needed or maybe not, right? If you come in and you get a really nice quality results, like it's not something you need to do on an annual basis or every 6 month basis. Maybe it's just every 5 or 10 years, depending on the situation. So who should get a Wavi brain scan? I broke this down into different sections here. So individuals with cardiovascular risk factors like hypertension or high blood pressure, arterial plaque, or atherosclerosis. So that's literally you have a blood vessel. Let me get this in front of the camera. You have a blood vessel, and is part of that blocked off? Well, if it's happening in your heart or your neck blood vessel or a leg blood vessel, it's happening in your brain, guaranteed. And we want to know that. And the Wavi brain scan can actually give us indications of that. I'll show you an example later on. If you have poor cholesterol profiles, now a typical poor, I don't really care about total cholesterol. It's a whole other conversation, but there are still poor cholesterol profiles, depending where your lipoprotein little a is, ApoB, that's really important, oxidized LDL, triglycerides, those are all really important. Inflammation, if you have elevated CRP, there's a lot of other inflammatory markers. Individuals with mental health conditions, so depression, anxiety, PTSD, ADHD, ADD, all of these we can see on the Wavi brain scan, and then we can monitor based off of certain therapies. Right? Individuals with neurological conditions, pretty much any neurological condition probably ought to have a brain scan, and including memory changes, mild cognitive impairment, true dementia or obvious dementia, Parkinson's, MS or multiple sclerosis. Anybody with a traumatic brain injury, so whiplash, if you had an old stroke, or if you have had a concussion, huge for concussion. I mean, I don't know why every young athlete doesn't have a brain scan. And really anyone who's concerned about your brain health, biohackers especially, anybody in sports, I kind of touched on that. And really at the end of the day, anyone with a brain should get a scan. I would say ages 10 and up is a good place to start. Maybe 15 and up. Unless you have a 10-year-old who's playing tackle football or some other very heavy contact sport, soccer, headers, right? It is FDA certified. Again, I kind of talked about this. There is a heart-brain relationship. It gives us a nice report, and then your provider can you definitely want to go over this you actually really need to go over this with a medical professional so that you can learn what it's really saying, and can kind of, that information can be translated into an actionable plan, right? Because at the end of the day, that's what we want. We want actionable plan and then carry through, and then we can follow up with another scan to make sure. So real quickly, again, I'm not, this is not, I just want to give kind of a quick overview here. Um, we have physical reaction time, and we have these little reference range. Now these are age adjusted, kind of by 5 years, every 5 years in the younger crowd. And then I think it's once we reach 30, then it's age adjusted for every 10 years. So kind of 30 to 40, 40 to 50. So this reference range will change between these two little hash marks here. And so this person is still within their normal range for their age. So it's kind of age appropriate for their peers. And it's a little bit on the lower end. Now, physical reaction time. This is measuring how quickly your brain hears a sound, and then how quickly your brain can consciously say, oh, I hear a sound, and then decide to have that neurological impulse travel from the brain down to the fingertip, and then you press a button. Okay, now this can change pretty quickly. So just one bad night's sleep, this can go down. So I don't put tons of weight on this. And then what I really like to go over is brain reaction time. So this is something that this measurement occurs before you are even aware of it. So an auditory tone occurs, and this measures how quickly your brain actually hears that tone before you consciously are even aware of it. So you can't trick it. One poor night's sleep is not going to make almost any difference here. This really only changes over many months and years, or if there's a traumatic event like a concussion or a stroke, or you've suddenly hit a severe depressive episode, et cetera, et cetera. This is really why I bought the Wavi into our office, is because of this. And we can actually detect pre-dementia. So dementia probably 5 years before it even shows symptoms, which is really cool. So we can put together an actionable plan. And then brain reaction voltage. This is the other coolest part of this test. So this is related to down here. This is your nose, right ear would go here, left ear would go here. The more voltage, the better. So the more red, the better. Less blue is desirable. And wherever the maximum was, so 13 microvolts right here or frontal left area, this is just the maximum score. So it's not the average, but it's the max voltage score. So age appropriate for this person. And then we also get we measure actual brain waves, which are not shown here. I think it's on the next slide, but we get a little marker for frontal alpha balance. This is a really good indicator of mood, especially as it relates to stress, anxiety, or depression. And then we can also measure the theta beta ratio. These are different types of brain waves. This person shows a lack of concentration, which is not always a bad thing, but usually people have not figured out how to work with that. It can be a superpower. However, most people have not figured out how to use it as a superpower. And then trail making tests, these are measures of executive cognitive function. And so this person scored pretty poorly on one of these and okay on the other. So this is complicated here. This is not really for you to learn. It's kind of like an EKG. You wouldn't probably know heads or tails from looking at an EKG. I know how to interpret this. Other providers in our office can help to interpret this. But it's showing us on that previous slide the voltage in different areas of the brain. This is actually like if your nose was up here, right here was here, left ear, so bird's eye view looking down. And then that, the kind of the chronic marker as well. So it's really measuring the speed of the brain and the power of the brain at each of these individual spots, which is super cool. And then we have the theta, alpha, and beta brainwave frequencies that it also monitors. And I'm not going to get too into this. Beta is like where I am right now. I'm calm, cool, collected, but I'm very engaged because I'm giving this little talk. Alpha is a little bit more of a typically where you would go to be in a really calm, cool, collected state, but very like zen. Theta tends to be most people hit this when they're drifting off to sleep. And then this is actually just a numerical kind of report of all of those prior speed dials that I showed you. So again, this is something that your provider would go over with you. So just a little bit more in depth. The physical reaction time, very, very acute, can change from day to day. So I don't tend to put too much emphasis on this. The brain reaction time, I think of this as, is your brain working like a snail at a snail's pace or quickly like a rabbit's pace? And so on this one, red is actually better. You want it to be over in the faster rabbit end of the zone, not the cold, dark snail end of the zone. And this, I mean, if you get chronic sleep deprivation, a concussion, again, it can measure pre-dementia or even arterial plaque in the brain, so brain blood vessel health. And then brain reaction voltage, again, these are related. So the maximum voltage is what this score is. And this is pretty acute, but not typically changed day to day. It's more like a week to month change. And it's literally measuring how much voltage is on the surface of your brain. And so this is really how much power. So you might be quick like a hare, but is there a lot of power behind it? You want to be quick, like lions can run very fast, right? But you want, and you want powerful. So hopefully that's a good analogy. I just threw that up. Over here, I want to show you, this is kind of with time as we age and then cognitive decline, cognitive ability. I feel like people expect as we age for our brains to get less and less healthier. And there's kind of this drop off. Once you hit 80, 90 years old, like your brain is you're supposed to get senile. It's actually not true. You should die when you're 90 years old and frankly still be pretty darn sharp as a tack, or at least however you were the rest of your life. Maybe, I mean, a 1 or 2% decline, 3% would be kind of more reasonable, but this is not normal. This is not ideal. It's not what should be happening. I actually already kind of mentioned this. So theta beta ratio, this is more your concentration, frontal alpha balance, anxiety, depression. Talked about the trail making tests, like you can read here. These are overall executive function tests. The trail making test part A provides information on visual search, scanning, speed of processing, mental flexibility, and executive functions. And then the part B test here, this is a little bit different than part A, and it's measuring how well your brain does when extra demands are placed upon the brain. So it's very interesting. You might it's almost like you might be quick like a hare, like a rabbit, right? But then once extra programs are added in, once your brain is asked to do something else, oh, you're not as powerful, right? You're not powerful like the lion. You're not quick and powerful like the lion. So that's what happened here. So we can see that, we can see kind of the next level of how you really are. Oh, I actually forgot that I put this here. So I blanked out the physical reaction time because this, again, I don't expect you to know how to read this, but these these two pages are kind of equal. Okay, so I can really delve in and see what part of the brain might need some help. Else to say about this? Again, the brain reaction time, like we can detect Alzheimer's dementia 5 years before it actually even onsets with about 100% accuracy. Um, the software can actually detect PTSD. I think they did a study, 700 out of 700. So what they did was they took 700 vets with diagnosed PTSD, and this brain map software diagnosed it correctly 700 out of 700 times. That's pretty incredible. So this is very good data. This is very good quality data. Um, yeah, very good quality. And then the brain waves patterns. So this person, just real quickly, and you've got to have a medical professional like read this for you. But here I circled height. There's way too much theta. So this person probably has concentration issues, maybe presenting as ADHD, and then executive brain functioning difficulties. And then there's low beta globally all over, not just part of it, but this is also going to show us, it's going to present as a reduced cognitive efficiency and chronic hyperarousal or anxiety, right? Or maybe not anxiety, but like hyper aroused. Doesn't always present as anxiety, though sometimes it can. And then, yeah, so those reports, those are all summarized here. And again, we should be doing in this green. We should always have this brain on the left-hand side. We should not turn into this brain, and yet so many people do. What else to say? Most of these measurements are accurate within 6%, so plus or minus 6%. So like when you get your total cholesterol blood test, right? And your number comes back at 184, that's plus or minus 15. So your real total cholesterol is probably more like anywhere from, even though it says 184, it's actually 169 to 199, right? So you always want to know how accurate something is really going to be. The database, the way it was able to identify 700 out of 700 PTSD in vets is because they have a huge database. Between 2010 and 2019, over that like 10-year span, they had over 100,000 scans. I don't know where they are today, but you can imagine if they got 100,000 scans up until 2019, they're probably looking at, I don't know, 200,000 scans now. So that I'm totally throwing that out there. I don't know that, but it's a lot. That's what I do know. This, just wanted to show you this study. This is using the WAVI, the P300. That's kind of the buzzword for the WAVI, how it detects this. And it's looking at 180 patients and their cardiovascular risk, including blood pressure, atherosclerosis, which is plaque in the arteries. So here's a picture of a healthy artery, partially blocked artery, and then a way too blocked artery. And so this is like a zoom in here. This is no plaque, so healthy artery. we get these nice dips. This is the dip we're looking for. This is really important. And then here's a brain where you can see it's not as red here. And so right here, it's looking and it's saying, there's probably plaque here because the patient is in the red here and it's not getting this dip. And so that's why I say we can actually look, and even though this is a brain scan, I can actually tell about a person's heart health quite often. And then same with blood pressure. It's kind of the same story. Okay. So very fascinating stuff, in my opinion. So I'm going to posit these questions again. This is kind of I'm pretty much done with this part of the talk. Um, again, it's kind of like how, on a scale of 0 to 10, how healthy do you want your brain to be? Where are you at? And why do you want that number? Really, why? And why would you not get a WAVI brain scan? I would, I believe very strongly, that's why I'm doing this. I don't ever want to take advantage of anybody, but the value is there, whether you can get it covered by insurance or not. And Medicare gets currently covered by insurance. Most PPOs, it's covered by most of them. And even if it's not, the value is still there, I believe. But what do you believe? So anybody who should get a WAVI brain scan, in my opinion, I'd just highlight this last part right here. Everyone with a brain. Pros and cons, right? I like to consider pros and cons. And so pros and cons of getting a WAVI brain scan, there's almost no downside outside of time, effort, money. Those are really the only, because it doesn't hurt. It takes an hour out of your day. Get a little bit of salt water in the hair. And then the money, again, I mean, unless you're really struggling for money, obviously that's a different situation and you don't have Medicare. But outside of that scenario, I believe the value is there, right? There's because everything else is an obvious upside. So love your brain, it has a story to tell. So if you want to see a little bit more, stick around, but feel free to take off now. So now for a few more examples. I'll try to be quick with these. This will probably take another maybe 15 minutes. So more details. Just wanted to show an example of a baseline. So this was in, geez, was this the Olympic athlete? Maybe this was a college athlete, but this was their baseline. So before the season, I think this was football, or maybe it was soccer. No, this was football. And so we can see post concussion, suddenly their voltage went way down, and they're not getting the type of dip that they got before. So, and then you can see this is an example of someone who had the concussion. Again, there's like not this nice dip, and then they recovered. So we did the brain scan again. You can see the recovery, and it's like, okay, now you're good to go back and play football. Don't play, even if your symptoms are gone, but if your brain has an electrical signal like this, don't play football or what other contact sport. Right? So that was an interesting little case. Remember, when it comes to concussion, like the brain, it's 3 pounds of basically a mostly fat, kind of the consistency of tofu. So the brain is delicate and it sits inside of this almost like a metal cage called our cranium, our cranial bones, our skull. And if it gets bounced around too much, that tofu gets a little bit damaged. Now, the good news is the brain is also actually really good at recovering and healing. It's just most people don't know how to do it well. Um, Two more examples. These are not my patients, our patients, but this was somebody with Alzheimer's. So session one in 2016, and then 18, and then 19. They basically just got better and better by going through a cool protocol, which I'll show on the next slide, I think. And this is oh, I forget the doctor, Dr. Boone, I think it is. He helped to run some of these WAVI brain scan studies. So it was very, very cool. And then this was kind of their cardiovascular markers. So from age 60 to age 61, after going through a protocol, the brain power, the brain speed, the reaction time, everything improved. My head is in the way to look at some of these other numbers, but basically just everything improved and their symptoms improved, which of course is the coolest part. So this is what that doctor kind of used. Now there's a lot more that goes into creating a healthy brain, but still pretty interesting. And I like to throw this up on here. You know, we have our brain. It's like 100 billion neurons. They're all fed by these blood vessels. So this is a BodyWorks example of all the blood vessels that are in us. And check out how much blood goes to the brain. It's incredible. So I'm going to run through three more case examples from Oasis. The case number one was someone with severe depression. Case number two, severe neurodegeneration. And case number three, just a kind of on the outside, a healthy person, but kind of an unhealthy lifestyle, at least for her. And then kind of the after joining in on the healthy lifestyle bandwagon. So that first case of severe depression. Um, so what are we looking for? So the actual brain reaction time was pretty good in this person. However, the voltage woefully low. Like this whole left side of the brain just woefully low. And so this is someone who had lifelong depression, but pretty well managed for the most part. And um, but then hit an episode. I was like, let's do a brain map. Sure enough, saw the low voltage, made some suggestions, and interestingly, after just one of the ways we help that is after just 5 lens sessions, or the new neurofeedback, upgraded neurofeedback that we do in our office, after just 5 sessions, came out of the depression hole. So, which is super powerful, super powerful, super neat, in my opinion. So again, this is kind of this is my chicken scratch nose up here, kind of bird's eye view looking down at the brain. Again, this is not for you to look at, but this is what I see. I see super low voltage, right? You have like somebody can't feel good with brain voltage that's that low. The maximum was 5 microvolts, and it's like a minimum ought to be 6, right? Well, the max was 5 microvolts. So of course the person's not going to feel good. This case number two, a man with severe neurodegeneration, actually a little bit of a very complex situation. Even the neurologist is a little bit stymied. But early 2023 actually was doing really good on the brain voltage, and then had an episode, kind of extended episode, did this. He wasn't thinking as well, having a very hard time carrying out multiple sequence events. Sure enough, the entire front of his brain has like no voltage, 0 microvolts is what this represents. Zero, half of a microvolt, 1 microvolt maybe. Like it's hard to have that executive function with a brain that looks like that. So the question is, what could we do about it? That's not the point of this um, video here, but this is that same man. What did I do here? I kind of circled this area. So posterior theta was a little bit overactive. So it shows sensory integration issues and confusion, which this man was showing. And then low global alpha, um, stress, adrenal fatigue, that doesn't mean too much. Confusion, reduced cognitive stamina. So we can basically see it on his brain map, right? Um, and this is an individual who seems super bright when you're just talking to him, but then when he's like supposed to do a sequence of events, he just can't do it because he has no voltage in the front of his brain. This is something that the neurologist doesn't even look at. Fancy neurologists, they'll do a QEEG, but those are really only just looking for seizures. That's what most neurologists look for. They don't even do this, and it's mind-boggling why more neurologists don't have this technology in their office. And then case number three, this is just kind of a cool story. Actually, I have, so the gray is her markers before, and then the black is the newer markers. The first marker being end of 2020, second time was middle of 2023. I can just see a lot more voltage overall. The max voltage went up a little bit. The reaction time is pretty much the same. Again, I don't put too much weight on that, but then the brain reaction time, that went up a lot. And that's the hardest one to change. So this is just phenomenal. Originally, in 2020, she had these areas of the brain waves that were suggesting more rumination, asking a lot of questions, which was true, like too many questions. More, not that there's ever too many questions, but more questions than she should have been. She just wasn't retaining what she was told, and it wasn't because she wasn't paying attention, right? The effort was there, just the brain wasn't able to do it. So that was showing up, and then this might not mean much to you. Real quick explanation. Some people might look at that red and say, "Oh, but that's an issue." You actually don't really put too much weight on those outside circles. You're really looking at these middle ones, and so that went from like not perfect to basically perfect. And this was, I think, the biggest things were she avoided gluten and she cleaned up her oil act. She also did other lifestyle stuff too, but I think those were the biggest ones. So, in summary, that's pretty much it. I'll just say the YV brain scan is truly an amazing tool for pretty much anybody with a brain so that we can monitor and make sure we are continuing this type of brain, keeping people on the green line rather than deterioration. And again, this is like cardiovascular, right? It's mental health, it's neurological health, it's anybody who just a biohacker or an anti-ager or anybody who plays sports, and again, just anybody with a brain. So I love your brain. It has a story to tell. And again, thank you so much for spending your time with me. Dr. Yashram signing out with Oasis Family Medicine.